Hey guys, Dr. Ulm here with the silent Dr. Kraft today. We're going to do a demonstration of neurodynamic dysfunction treatment. And what neurodynamic dysfunction means is essentially a dysfunction in the way that the nerves move mechanically throughout the body. And you may or may not know this, but they need to be able to slide and move around the joints and through the tissue to function normally. And when they don't, you can get all kinds of symptoms like numbness and tingling or pain or aching or muscle tightness. And so a lot of times we have to sort of look through it in a detailed examination and figure out if we need to use this tool. I encourage you to watch the videos, a more comprehensive video on what is neurodynamic dysfunction, and also one on when do we use it and what conditions is it good for. So I'm going to do a demonstration, and with this what we do is we essentially are going to have the patient and the doc move the nerve, have it sliding back and forth, and then the doctor actually is going to sort of like hold down or pin down some of the tissue to encourage the nerve to be able to slide through something. So in this case, we're going to do a median nerve. That's one of the big nerves that runs down your arm. We're going to do a median nerve floss or mobilization, and we're going to come to this area right in here. There's a muscle inside your forearm called your pronator teres, right? And so the pronator teres is going to run like this, and that nerve goes underneath there. So a lot of times it can get bound up in that little container. So what we can do is we can take a contact up here by the hand, and then the patient, we're going to have you guys look towards and away. When you look towards, it allows the nerve to slide in the direction of the hand in this case. And when you look away, it actually moves the nerve more towards your spine. So it's pretty simple. We're going to have a little bit of contact in here, and we'll start with the nerve like this. Dr. Kraft will look at me, and then I'm just going to straighten this arm out and sort of bring this back like that, and then he's going to look away. So now when I move this way, we're sliding the nerve towards his hand, right? And then when I have him move the other way, his head movement actually pulls the nerve in the other direction. And we just kind of go back and forth between here. And what this does, this gentle mobilization, gets that nerve to actually move through the container where the dysfunction is located. And once we restore normal movement, a lot of times the symptoms just go away. So it's a really, really powerful tool. We probably use it, maybe 15, 20% of the time, but it is incredibly helpful in those cases.